Hi, I'm Christopher Lipari from Jacksonville Center for Reproductive Medicine. I'm a reproductive endocrinologist that has done more advanced training in both infertility, hormones, and also surgical approaches to reproductive issues like endometriosis. I wanted to take this opportunity today to kind of discuss with you guys what part of my practice has been real passionate about, and what I'm passionate about is helping women that have been suffering from endometriosis, because I feel like it's probably one of the most rewarding things to be able to help them get through and get their lives back, both from a reproductive and fertility standpoint, and also from the standpoint of just feeling what normal should be like. So the first thing I would say is that a lot of people are made to feel that endometriosis is not necessarily there, because there's no special test someone can do to really determine whether or not it's there before someone goes through an invasive procedure. And the problem with that is there are a lot of young women that are made to feel that there's nothing wrong and they should just take birth control pills and Motrin and they should be fine. And that is exactly opposite from our feeling. We feel that when someone is having pain, that their body's telling us something, whether they're trying to have a baby and having issues with that, or they're just trying to get through life, or those 5 days during the month that are excruciating. So I wanted to talk a little bit about how we increase our suspicion of finding endometriosis. I mean, essentially, when we think about it, women that have a fertility problem automatically have a higher risk of endometriosis. And when you look at the literature, probably there are a lot of studies that will show that the presence is probably as high as 40 to 50% in that group alone, regardless of whether or not they're having significant pain. Now, not everybody that I see is trying to have a child. So a lot of times people come here because they're experiencing pain and they want it evaluated, and they've been passed around from doctor to doctor. Sometimes it takes an average of 7 doctors before somebody is finally diagnosed with endometriosis. So it is extremely frustrating for you guys that are dealing with this, because you are just trying to find a professional to help you find it, and you're dealing with this excruciating, debilitating issue, and no one's really listening. So we're listening, and really the big factor is, what is your history? So before we do any testing at all, we have a really good idea who may and may not have endometriosis. Really bad periods as a teenager is a huge factor that we use to try and help us know whether or not it may be there. And I'm not talking about the periods where you take a Tylenol and you're fine. I mean the type of cycles where you want to sit in the tub, you want to use a heating pad, you miss work, you miss school. These are factors that really indicate that there's a high likelihood that we're going to find something like that. In addition to that, in women that have pain with intercourse, in women that have chronic pelvic pain, all of these factors significantly increase our chances of finding it, in addition to even pain with bowel movements or pain with urination. So there can be a number of things in the history that we use really to kind of help us figure out and focus our diagnostic approach. I mean, a lot of times we learn, even during medical school, that 85% of the time we know kind of what's going on before we even do the first test. And it should be that way with everything. I mean, I think that if we just listen to your history and what the problems are, that most physicians should be able to kind of figure that out, and then use our testing on the side to try and help us kind of further increase our suspicion of finding that. So I think that's the most important thing to know. So if somebody has really bad cycles as a teenager, if they currently have chronic pelvic pain, they have fertility issues currently, they have pain with bowel movements or pain with urination, these are all factors that could be kind of your body telling us that there's endometriosis there, and it's something that we need to kind of look for.